It's episode 15 of The Boost with Patty Morrow, Vice President, Behavioral Health Services at Mercy. Let's go. All right. Welcome to The Boost, conversations with people promoting mental health. And I am really just over the moon about this episodes that we're launching into because it's with Patty Morrow. She's the Vice President of Behavioral Health Services at Mercy. Certainly, you know about Mercy. They're one of the top 25 health systems in the country. Their NRC scores are through the roof. And it's really exciting to me with Patty here because she's an expert. She's been with Mercy going on at least 16 years. And Patty will correct any mistakes I make in a minute. But I think 16 years in the behavioral health focus as a regional director and now the VP. And they're bringing innovation to bear. They're bringing complex care models to bear to solve for access and awareness, and really just providing some incredible solutions. So she'll speak to it best. Patty, it's great to have you here. How are you doing today?
I'm doing great, Steve. It's great to be here, and it's an honor to really be present on this podcast and share some time with you.
Well, it's my pleasure. And, I've been in the healthcare space, either on the marketing side or sometimes on the SaaS side, technology solution side for a while, and also the risk adjustment side and the quality care side. So it's so exciting to see this transition. It's sort of a, I look for tidal waves and change in the industry, and health systems are so powerfully positioned, sort of with a first mover advantage to have the resources and the quality care and the locations that can help us continue to bring mental health, mental illness care, behavioral health, addiction treatment into the continuum, to kind of integrate it into the biocare that health systems have been providing for so long. So there's so much to talk about with you, but I'm going to stop rambling and get into the two questions that we always start out with, which are fun. It's the virtual hug and the shameless plug. So Patty, the virtual hug we'll do first, and that is, tell us please somebody or something you're thankful for today.
Steve, thinking about that and really knowing that the question around gratitude, which is so important, I think, for our wellness in general, is to really think about, what lifts us up every day. I really want to point to our mental health workforce and the people that have been in the front lines for not only decades, trying to bring care to people in need, but certainly through COVID and kind of where we are now, looking at our workforce, that I think they have had to have an extraordinary level of resilience. We never had the opportunity to do anything other than continue to serve. And we had to get super creative about how we did that. And our staff, our workforce, our clinicians, nurses, techs, physicians really rallied around that. And I feel so incredibly blessed to have been witness to it and really coming alongside our caregivers. Every day they inspire me, and I hope I do some justice in my role to help kind of support and serve them, but they are incredible human beings who are called to this area of healthcare.
Mm-hmm. Yeah, that's wonderful. It's always lovely to start with gratitude, and I'm always curious what people say, and giving, I mean, all the kudos to mental health caregivers. That's the caregivers is such an important word. There's so much generosity and service that can go into that role depending on your engagement level with it. It's tremendous. I don't know how people do it, quite honestly. It takes better souls than me to do that work day in and day out. And you really are coming alongside people and carrying the burden, with them. And there's a part of that it seems like you just take with you as a caregiver. And so that's something I'm passionate about, is how can we care for the caregiver? There's, of course, burnout has been a topic of conversation because of the heavy lift that it's been, especially in the 3 years of COVID and coming out of COVID, and also just uncovering how much demand there is for mental health care and mental health services. So that's a wonderful, I would be right there with you. I would jump on that bandwagon of gratitude. So for the shameless plug, we encourage people to get a chance to brag about yourself in a safe, fun way. So tell us what you do great as a professional. Tell us more about Mercy and the programs that you're excited about and proud of there. It comes from you best. So feel free to brag a little bit.
I in thinking about that, it has just been a journey of, I like to think of it as a journey of reciprocity. What I do best has been given to me through the clients that we serve, the lessons learned, seeing the humanity in people in need, and really just putting charge in the battery for me to, really want to drive better access, better performance, science-based, evidence-based practices. But that's all been inspired by people who you see get well and struggle through their own, challenges. But it's really been a gift to me personally and professionally to have that experience in my life. I know one day I will be sitting on a rocking chair trying to remember all the people that touched me in terms of my professional growth and development. I'm a social worker at heart, so, and what really ties into my alignment and really love of Mercy is, that we are really a safety net organization for people in an integrated way, the way that we deliver healthcare, but specifically in behavioral health. It is so embedded in our mission, and the values that have really been passed on to us through the Sisters of Mercy that founded our healthcare organization. So it's been a great opportunity and a gift to serve in this role, because I've been given the bandwidth and room and space to be able to create some innovative ways that we serve not only people that may have chronic mental illness, but all the way through that continuum of people having episodic mental health challenges and really just needing care, care in the right place at the right time. We've really been given the room to create solutions along with other partners, obviously, but that is really the anchor point of our mission, and knowing that we really take all comers. We are really, our sole focus is to serve the communities where we exist. So it really aligns well with not only my professional mindset, my personal mindset, but getting the chance to really create programs and pilot new things that I think I haven't seen widespread necessarily in the behavioral health space. I think we're charting some territory, and that's been fun. It's been a really fun experience to be able to do that. So, yeah.
So the word safety net jumps out to me, and widespread jumps out to me. And it reminds me of this book called Healing by Dr. Thomas Insel. And he talks about how at one point we sort of had this initiative for a federal safety net for some of the very complex, serious mental illness cases. And then we sort of fractured that down to the state level. And so it's now, I think, organizations like Mercy with this mission-minded approach to integrated care, and especially for people falling through the cracks. And as my passion is that we sew that safety net back together nationally. So I have some questions following on that, but before I do, if you could just give us a sense of the scope of the states and the regions that you all cover, so that people know, if they're not familiar with Mercy, where you all are.
Sure. Our health system footprint really exists in the Midwest, Missouri, Arkansas, Oklahoma, part of Kansas. Our behavioral health footprint is really heavily anchored in our St. Louis metropolitan area, but we have services throughout our healthcare ministry. We also have mental health programs outside of that region. We have a Mercy Family Center in New Orleans that really provides a lot of mental health care in that community. And that really evolved out of the crisis of Katrina and has really grown and blossomed to serve that community. And we have some other ministries, El Dorado, Texas, for example. There's some services there that support women, domestic violence. So our founding order of sisters really, evolved this healthcare ministry, but there are other communities that we serve with different types of programs, and it's really a great part of who our identity and who we are as an organization.
That's awesome. And
Yeah.
that's the long arm of care, Texas and St. Louis and Louisiana. That's simply amazing. And that seems like to me a trend, or a macro trend, is the opportunity for a health system to um, uh, expand service and care, as we're all trying to solve for access and helping people in need. Health systems are perfectly positioned. So, to circle back, you were talking about some collaborations that you were doing. Talk a little bit more about the programs that you're offering. I'm a little bit familiar with the Beacon program, but if you could maybe go into that, or other programs, either from a service perspective or an innovation perspective or collaboration that you're really excited about, that Mercy's been working on.
Great. Beacon, I'm excited to talk about because it is really it's been a pilot program that has really brought a lot of innovation to our region. So we have a number of collaborating organizations that have been a part of that program. So really what that is we recognized that there's a very small number of individual people that have very complex needs, social determinant needs, physical health needs, mental health needs, substance use disorders, the whole comorbidity elements that really keep people from getting well and on a path to wellness. We learned through the National Center of Complex Care, or otherwise known as the Camden Coalition, that there were programs uh, coming out of incubation across the country that were really trying to target these complex care patients. And I know that that idea is not necessarily novel. However, bringing that behavioral health element in a really focused way, I think, has been pretty novel. So about 35 to 50 individuals a year that essentially have routine visits to hospitals. They often have very poor health status, have unstable psychiatric issues, have substance use disorder, active substance use disorder, homelessness, food insecurity, you name it. We decided through really data mining, we identified these patients through a whole algorithm of figuring out who are these, of the thousands, tens of thousands of people we serve, who are those people that are really in this cohort of patients. So we did a lot of work on the front end with the technical support of the Camden Coalition, identified these individuals, and really went to, we began to launch a 3-year pilot. We also did that through some innovative funding. Mercy, as I've talked about our identity many years ago, through the wisdom of some of our finance leaders, started what's called a a 340B committee. So think about that as tithing some of the savings that we get from our 340B program into a special fund that a committee, essentially, we could take a proposal forward and ask for funding. So that's how we funded this 3-year pilot. And our goal was to show that we could do better. We knew we were spending a lot of resources on this 35 group of 35 patients, but we could essentially repurpose some of that money that's already being spent, so to speak, and really try to get to better health outcomes. So we did that. The Behavioral Health Network of Greater St. Louis is a wonderful organization that I'm a part of, and they really became the convener around this pilot program. So that they were an integral partner in this, along with one of our CCBHOs, organization called Places for People, located here in St. Louis. If you don't know about them, you should, because they are an amazing organization that has just incredible programs and high levels of engagement and so on. So we came together and said, we're going to work together toward the good of this cohort of patients. Fast forward 3 years, we're at the end of our 3-year pilot, and I just presented to some folks here within Mercy yesterday. In fact, we've seen over an 80% reduction in their hospital utilization. More than 70% of them are housed. They're doing well. They're connected to a medical home. They have a specific team that really works with them. So there's a specific beacon team that's really helping drive some of these outcomes, and those are clinicians through Places for People. But it's been really a demonstration project for us to see, could we stand up this model in the greater St. Louis region and really get, again, to our targeted goals of better outcomes, more stable social status in terms of housing, things like that. And then certainly trying to demonstrate that this is a win-win-win in terms of cost, how we're managing cost within the healthcare system. So it's been wonderful to be a part of. We actually did a national webinar with the Camden Coalition this week as well to kind of shine a light on what we're doing here in the St. Louis region with the Beacon program. So a lot of pride on the part of our team in terms of really bringing this over the finish line and getting to where we hope to be. So it's been wonderful.
That is enormous. That's huge. 80% reduction. I don't know your ratios, but I, sort of think of the Pareto's principle where, it's like 20% of your patients maybe are responsible for 80% of the load of care, or the cost of care, perhaps something of that nature. And then within that 20%, it happens again, so you can dial down with some good data analysis, finding the rising risk patients with complexities and comorbidities, which in my mind get compounded. It's more logarithmic or exponential potential for costs and care rather than sort of linear or arithmetic. It goes up and to the right pretty quickly for some people who, unfortunately, whether it's behavior or nurture or nature, whatever it is, has caused these very complex health issues. So you're out there as a team, not just Mercy, but your partners and co-collaborators and other organizations out there, doing everything you can to find that subset of patients that is ultimately, that's a wonderful lesson, actually. Ultimately, through extreme generosity and extreme commitment to those people, it probably does also come back to help Mercy. Not that that's the reason you're doing it, but it certainly also takes burden off the health system and frees you up to do more and better care for other people. But the altruism and the drive and the mission is clearly centered in a really great place where you're out there looking for these people who have fallen through the cracks. Is there a story that you can tell anonymously, or perhaps of a patient that brings it kind of home from a human perspective, now that we've kind of covered the macro?
Sure. Yeah, that individual that comes to mind is a gentleman who really had chronic severe depression and alcohol dependence, and was in not only our emergency rooms, but an emergency room every single day, sometimes multiple times a day. And his depression was so severe that he was homeless. He incurred some severe injuries as a result of freezing weather, and actually ended up needing a lot of care around that. Might have lost his extremities related to that event, but this program brought him back. He is well. He is in his own home with a lot of support. He is sober. So, without this type of approach, I'm pretty confident he may not be on this earth anymore. But just that wraparound approach, and everybody feels good about this outcome. I mean, it's just where we want to be and where we find purpose. So that is one that sticks out, Steve.
Literally saving lives. That's
Yeah.
awesome. And just how you described it, it speaks to the biopsychosocial aspects of, it's not just depression, it's addiction, it's homelessness, it's probably loneliness, it's physical
Yes.
injury due to cold and other factors. So that gets really complicated really quickly. And so to have a place where this person is sober and a roof over their head and alive, very different outcome than what's the other potential. So um, okay, so let's talk a little bit about with the programs that you're doing. A lot of our listeners are either executive directors, at group practices or regional offices, or they're marketers. Is there anything you want to highlight when it comes to the way you talk about your programs, or how you get the word out to either other healthcare providers or consumers, if it's more of a B2C approach? What are you doing to promote your behavioral health services, or do you even need to? Is it simply you build it and they come?
Yeah, for our, as a provider in a health system, there is more need really than we can uh, take care of internally. And I think that's why, these relationships with being a part of a spoke in a wheel in a community becomes so important. We are really focusing in a lot more on maternal mental health. There's some exciting things on our path ahead. And we already have some very specific programs for women with postpartum depression, substance use disorder during pregnancy. So those are services that we hope to grow and bring to more people in our communities, particularly in some of our states that really have poor scorecards around morbidity, mortality with women in their mental health conditions. What I what I would also share is that we've spent a lot of time, and really this is sort of our ongoing North Star, is how do we continue to create access wherever wherever that person may need access. A big focus for us in the last 2 years has been how do we bring robust support to our primary care footprint. We have one of the largest primary care networks within our system, and so we launched over the last 2 years with a vendor, Concert Health, who was our collaborator on this. We implemented collaborative care in every single primary care clinic. So we're upwards of about 275 clinics, 1,300 primary care providers, pediatricians, OB docs, internal med, family med, can now push an easy button in our electronic health record, and they have a team that comes alongside them almost instantaneously, working with that individuals primarily around depression, anxiety. It's using evidence-based best practice. We're seeing significant reduction in symptoms. They are also helping us with our zero suicide work. We have a number of initiatives where we're a zero suicide organization, but they screen for suicide risk, and they have a special registry essentially for people that, there may be concern that there's some risk there. So last year we served over 8,000 people in our collaborative care management program that would have otherwise not gotten the help that they needed or have been on a months long waiting list to see a provider.
Mhm.
So we're really happy about that program and what it's doing in our primary care world, starting to look more also at specific populations, certainly seniors, for lots of reasons, looking at what our older adults are struggling with related to depression and anxiety, in particular, suicide risk. But starting to also kind of target diagnoses, someone who may have a co-occurring depression and CHF diagnosis. We know those are folks that could use more outreach and more help. So just refining that program, our collaborative care program, to be its optimal best for our clinics, is work that's ongoing. So that's exciting as well.
Mm.
Maybe I'll
Yeah.
pause there.
That's wonderful. And so, with the concert collaboration, are you recruiting behavioral health clinicians or providers physically near to where these offices of care are, or is there a telehealth component also?
There is it really is a telehealth virtual
Okay,
program, and it's scalable that way. We serve a lot of rural communities, and we're able to really knock down barriers related to transportation and so on.
huge. Yeah.
Um, but our one thing that I think is really special about this is that there's a designated team for a clinic. So the primary care team gets to know that particular team, including consultative psychiatrists that are in the model. They're kind of talking back and forth about diagnosis and medication management and those things. And then there's a behavioral care manager or a therapist in the model that's really delivering doses of care. There's a lot of research out there that says, 50-minute therapy sessions aren't necessarily the way to go for everyone, that, where we can provide 30 minutes or 20 minutes, dosing that to the individual at perhaps several times a week becomes more efficacious. So it's a really malleable, flexible model in the way that it's structured, and CMS has really endorsed this as a way to expand care. So we're all in
That makes
on
so much
that
sense.
model.
Yeah,
Yeah,
that makes a ton of sense. I mean, just thinking about the clinical distribution in counties, or my sister lives in a very rural mountain town in Northern California. It's like this, it's just not spread equally across the country. And so when we
right.
think about access and we think about rural populations and education and clinical access, that's certainly one way we can jump the wall of the obstacle of how do we get care to the right, like you said, to everybody who needs it wherever they are, and then in a fractional way where, yeah, maybe it's not the 50-minute talk therapy, sit down face to face, but that doesn't mean it's not providing a ton of value for people who need it and may not have it. To circle back to something interesting, you said the zero suicide initiative. Talk a little bit more about that. That's unique.
We Mercy, probably 6 or 7 years ago, in Missouri is really where we started this. We put a stake in the ground and said, as a health system, we want to look at suicide prevention in the same way or equal to the ways that we look at things like managing hypertension and infections in our hospitals. So we began a journey to become a zero suicide organization health system, which is there again, not common. I think some health systems, Henry Ford and some others, have really adopted this as well, but it's not a common approach. So we sent leaders and a team through Zero Suicide Academy in Missouri. So much our community mental health center partners are obviously very engaged in this, but as a health system, it was sort of a unique um, stance that we were taking. That this we care about this too. Um, so from that point in time, again, our journey has included hiring. We have a specific role within our organization that is a zero suicide coordinator, and the person we have in this role is recognized as a national expert in this space. Has really received a lot of accolades around her subject matter expertise. So that's been really wonderful to have her as an asset in this work. But we have really focused on culture even at the top of our organization, um, making sure that leaders understand that the importance of our efforts around zero suicide. Training and education has been huge. Really figuring out, we have 45,000 coworkers. How do we start to cascade knowledge, competence, comfort with our workforce around screening and how to ask questions, how to follow evidence-based best practice. So there's been a lot of work in that front, Steve. And then lastly, I would say we have some really unique programs tied to this. So one is that with certain populations within Mercy, you may receive a PHQ-9 depression screening digitally as part of an annual wellness visit. The ninth question on that screening is a question about self-harm. And what we didn't want to have happen is someone checks that box and not have an immediate response. So we have a population that we're focused on. This has been in pilot phase, but they are doing digital screenings. And if they trigger that ninth question, we have a virtual team that outreaches them within 30 minutes. So sometimes we're catching folks off guard. They may say, well, I didn't know someone was going to call me about this positive response, but I'm kind of glad you did. And we go through a more extensive screening with that person, and we're able to, really, it's again a safety net for people that might otherwise be sitting in a lonely state, with contemplation around self-harm, and we're proactively reaching out to them. Last year, 1,300 people got an outreach call from us simply through that annual wellness visit. So if you think about that, and it's hard to quantify lives saved, but I can't help but think there's folks in there that we have been able to kind of proactively intervene with. And of course, working alongside the 988 system and, integrating this really into our, the way we think about care in our communities. There's a lot of ways that we're connecting people then to care. So those are, we have really, through our zero suicide coordinators expertise and work, and it continues to evolve. But we've really looked at this as a way we measure quality. And we know that suicide rates are again increasing, and we want to try to make a difference in that way for the communities where we serve.
Excellent work. That's amazing. I just celebrate that, the work you're doing. That's so cool. And yeah, it's hard to always quantify it, but you can't help but think and know that those conversations and those relationships are net positive in some extreme ways for certain individuals within that 1,300 person cohort. Yeah, it's a little bit overwhelming, all the work you all are doing. I run a conference called the Mental Health Marketing Conference, and I have this idea to do a conference. It's inspired, called the Mental Health Access Conference, which is really a conversation we need to be having, because I can see you on stage sharing these best practices and these programs and these ideas with other leaders. The marketing conference side really started with that talk therapy individual, the provider or the clinician at a solo practice or a group practice. And we've noticed the demographic has shifted dramatically to be whether it's franchise organizations or health systems or universities or private equity or technology companies more than ever this year. I love to see this groundswell, and I continue to believe health systems are at the very epicenter of the work that we can do to knit the fabric back together and share progress that we're doing, because it takes sometimes 2 or 3 years, like you said, to run a pilot program and get the quality outcomes you're looking for, to even know if this is outcomes based work. So that's an investment that not every organization can do. It's the same way that, research and development happens a lot of times in universities. Is they have the resources and the time that it takes. So I just applaud you, the work you're doing. If is there anything else you want to share before we kind of wrap up? I have one more question for you that's fun, but anything else you want to share that you feel like our audience just really needs to know about the work you're doing?
Well, Steve, the only thing I want to offer to you is it's been a joy to get to know you, and you know, advocates like yourself, and you know, raising awareness and the voice and the forums whereby we can share the work that's going on in behavioral health arena, which is very broad. But your commitment, I'm looking forward to attending the conference this year.
I can't wait to see you.
But yeah, yeah. But we need as many voices, I think, as we can to, to borrow your words, really put the fabric back together and, coordinate this in a way across our country that no life would ever go without access to mental health care. And, that should be our standard as a nation, in my view. So thanks for the work you're doing.
Oh, thank you. Anything we can do to elevate it even a little bit is so positive for the work we're doing. So, thank you. That means a lot to me. So one last question, just to wrap up. Tell us something you're either reading or listening to. It could be a book or a podcast or a new rock album or anything you could think of. But what's some kind of content you're listening to or reading?
That's a great question. From a music perspective, and I appreciating you living in the heartbeat and or at the epicenter of the music world.
Yeah.
I have really gotten into Lake Street Dive. I don't know if you know them. They're a funky little band, so I can't stop listening to them on the radio or on my streaming, whatever. You're gonna guess my age here in a minute, but I would have you check them out. They're very good.
Noted. I don't know Lake Street Jive, but I'm going to check them out after this. Awesome. Okay. I love a good band recommendation. Yeah, you're not the first one to share a band I don't know, but that's because there's so much great stuff out there.
Yeah.
Well, Patty Morrow, it's been a pleasure. Thank you for being on the show and just for everything you do. And with that, we'll wrap up episode 16, but thanks again.
Thank you. Bye-bye.
Bye.